So, what advice should we give patients that have newly diagnosed prostate cancer? Well, the first thing in general, I tell them to take a deep breath. When you're diagnosed with cancer, everybody thinks that there is an urgency to do something. Prostate cancer in general is a slow-growing cancer, so take your time and research the options. Number two, get a second opinion, particularly on your biopsy slides. Get an opinion usually from a multidisciplinary group that has not only urologists but radiation oncologists and pathologists there. We see patients. We have a second opinion that we do every Tuesday morning where we go over all the new cases that have been seen. We see a case or two a month where somebody's advertised with prostate cancer. We look at the slides and say, there's no prostate cancer. So it's good to, and there are other markers that we can talk about that can be utilized to help us. A third thing is if you're thinking about surgery, talk to different surgeons that do it different ways. Just don't, talk to them about their experience with their side effects. It's the same thing. And a fourth thing is with radiation. Look at the options. There's a lot of hype about things like protons and why there might be some advantages of that in certain cancers, and prostate cancer is probably not there. And the other thing is that with patients is that prostate cancer, even if it recurs or is a problem, so this is kind of the fifth thing, there's still a lot of options. We talked about some of the newer drugs and things like that. So I think what you should do is continue to follow, check the PSA, and don't just get checked for a year or two and then come back when you have a problem. Unfortunately, some people think, well, I've had this done and I don't need to come back, and they come back and it's too late. It's usually you can salvage people with radiation and surgery and failures and cryotherapy. So in general, step back, take a deep breath, and don't rush into any treatments. Get another opinion. Look at the various treatments, read some books, and so forth.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.